ToRAISE Questions Doula podcast. This is Melanie Headley. I'm here with Thérèse Hakoun, the Executive Director of ToLabor. Hi, Thérèse.
Hey, Melanie. How are you?
I'm great. How are you?
I'm good. I'm feeling a little sleepy, but I'm here. And I miss coffee at this moment like I cannot believe. I wish you were drinking some.
I do too.
Yeah. But other than that, I'm doing great. So what's up for today?
So this is going to be a good one. We are going to talk today about how to talk to your clients prenatally about their construct of birth. And that is based on familial and cultural stories. So what is their whole belief around birth? What have they been told growing up? What was their mother's birth like?
Right.
Sisters, friends?
Right.
What's their idea?
Yeah. What is their idea, which is a really important thing to discuss. So we're going to do that. And just want to encourage people to continue to listen. Hey, and by the way, we're coming to understand that it can be difficult to sometimes leave a review for our podcast, which we are always asking people to do. And our editor, Matt, has looked into it, and it's really been confusing, and he's brilliant. It seems that if you have a mobile app of podcasts that you can't review, but there is a way to do it on a PC or your laptop anyway. I got to get he gave me all these really long directions that I thought, oh my God, would anybody really do that? But we'll put that out there, unfortunately not today. But for anybody we have lots of reviews on there, which we love. If you want to send us an email at ToRaiseQuestions@gmail.com to let us know how you did go about it, especially if it was on your mobile app, but just how you did it. If it's more simple than what we're thinking it is, we'd really appreciate it. That would be really helpful. And
and please keep subscribing. It's so nice to see all of these subscriptions coming in, and that way you can get all of the archives as well.
That's
so
right.
You can listen to all of them, and there's just so much to learn within these podcasts. And it's really, before I came aboard, I would listen to you and Sarah talk and just learn so much from each session.
And now
podcast.
It's you.
And now it's me. But it was just so helpful to me, and we are filling these bowls up with donations to draw from, with names of the donations you're giving to draw from for our Thanksgiving drawing. But Thérèse gives so much in these podcasts, and I learn just sitting across from you something new every time.
Oh, shucks.
I know. But please keep the donations coming. It really, really helps us put these out there, and it helps us just spend time during the day to come in and record and tape and just kind of pick Thérèse's brain. So those of you who are donating $50 to $99 are going to be put into the drawing of potentially winning a ToLabor tote bag, which is just the perfect size. It's a really big tote bag. Great birth bag, great whatever bag, diaper bag, whatever. 100% organic cotton, really cute. And then those of you $100 or more are going to be entered into the drawing for a 30-minute one-on-one phone consultation with Thérèse herself. So it's a big one.
And then lastly, if you donate $25 to $49, you'll go in the drawing for a necklace or earrings. It's like a goddess. It's the birthing energy spiral necklace or earring, depending on which one you would prefer to have. So we appreciate all donations, whether it be $1, $5, under $25. So don't feel that we don't want, you to contribute. We're just giving you some more incentive.
Yeah.
That's all. Yeah. And thank you for supporting us, but we're really appreciative. So we'll be right back.
So, construct of birth. how to talk to your clients prenatally, and it's so important that it is prenatally.
Yeah, I think, Melanie, this is something that on the ALICE and then to labor intake forms for clients has always been in there. And it's something that many, many times I have taken the time to really explain to the workshop participants about how important this particular question can be. And for instance, on the intake form, it says, what is your mother's childbearing history? And of course, you want to know, did they go early? Did they go post dates? What size babies? Those kinds of things. But even that, I just want to put in there that when they say, oh yeah, my mom always went early, ask the question about, well, was your mom induced? I mean, a lot of the people you're working with, the mothers were of a time when inductions were starting to be done regularly. So was she early, or was it by her own or decision, or by, actually, it's always her decision, I hope, but you know what I mean.
Yeah.
Was it her body's decision,
right,
or was it the induction? If she went past her due time, what does that mean as well? Like, what are these due dates? And then the conversation can get very educational in that way. But it always comes down to this when they're discussing the actual biology of their family history, the genetics of it. It's reminding people that they are not their mother, that they are themselves, and that they're not carrying their mother's baby, and they have a different partner as well, which is part of the genetic makeup of this baby. So
I get this question so much. Is the way that you labor hereditary?
Right.
Is it genetic? And I always say, well, we won't know until you have a baby.
I know it's my classic answer of yes, no, maybe so.
Right.
I mean, and even once they have the baby, was it related or not? Is it just, that's the way it just plays out,
So even if it is the same, is similar, is completely different, it's also just nice to talk about it.
Right. And then the size of baby, I had this conversation with somebody last weekend, which it does sound like there's a genetic predisposition. Sorry, I do need that coffee. Predisposition to maybe good sized babies in their history. I mean, she had like 3 children. She had the 10-pound babies, and her last one was 12 something. Mm-hmm. But she said, and immediately in my mind, I think undiagnosed gestational diabetes, or just gestational diabetic baby. But then she was sharing how her family history, her mom and her grandmothers had 10, 11-pound babies mm-hmm. as well. So it sounds like that's just what they were built to grow those size babies. And she gave birth vaginally to all her children. So did her family members.
That's great.
Yeah. So
with those nice sized babies came nice sized pelvises.
Exactly.
Yeah.
And right positions and stuff, I think, as well. But so it can have an impact, but it may not, and people shouldn't get hung up on that. Mm-hmm. But then it's the questions of the ones that we put out there that are really important besides the genetic, because I think the genetic is just like what you said, Melanie, maybe or maybe not.
Right.
And we really don't know until, why are we trying to figure that out now?
Yeah.
It's going to happen one way or the other. But it's more of, what were you told about your births? What was the perception what was the lens that you see birth through? What is that construct that you now have formed that holds this information? And we're going to go in more detail about that, but it is equally important to ask the partner, because the partner has been told or not told the stories as well. So
that will affect them. Their support will affect their role. Right.
And their decision-making process and helping them sort out that information. I always think of this, we talk about this in workshops, And I think about this doula who said to me in a conversation after a birth, one of her first births, and she said it ended up with the mom having a cesarean. And as the mom was getting prepped for the cesarean, she looked at the doula and she said, I knew this was going to happen. My mother had cesareans. And the doula said she was aghast because she had no idea. She said, I learned my lesson. I had heard you say that in the workshop, but I didn't think to ask. I didn't think it was really that important. She said, never again, because had I known, I could have maybe worked on helping her figure that out in a more healthful way, to see herself as herself, not as her mother or, So how do you address this?
I talk to them prenatally in our appointments, our 2 appointments. And I really do ask, and even in my class that I teach, I go around and I ask, share one birth story that you've heard in your life, positive, negative, like it's okay if it's a little intense, just share one birth story that when I say that, what's the first one that pops into your head? What's one birth story you've been told in your life that has had some kind of effect on you, or maybe it's bringing some feelings up for you with your baby? And that's interesting in class because then we have a bunch of different people in the class going around the circle, and each of them have something to share. But then prenatally, with my appointments with my doula clients, definitely talking to the mother and the partner, asking what their own birth was like, and have they talked to their parents about what their birth was like. That's funny to hear. Some people just haven't had that conversation.
I have shared this also, and this is all relevant to how important this the storytelling is. I teach these 6th grade girls every year about pregnancy, labor, and birth. And, we have a pregnant mama come in and we do palpation and we listen to the baby's heartbeat. But I start the class with these 20 girls who are in it by saying, tell me your birth story. Tell us, not me, tell us your birth story. And I swear, Melanie, everyone, I sometimes just want to weep. First off, some have no idea. They go, I don't know. I just know I was born at that hospital and that's that. Others are so, I think, does this mother know, does this parent know what they've imprinted on their child's brain, their heart, their experience for a lifetime? I mean, some of them are just terrible stories, literally saying, oh, my mom said it was the worst day of her life. The pain was unbelievable. She could not wait to get me out. One girl said, my mom says it's even hard to celebrate my birthday because it's such a bad memory. Now, what the parent actually said is questionable,
right?
But that's the perception. That's the one that they're sharing.
And that's terrifying.
It's terrifying. And so it's going to, or my mom almost died, or I almost died, but they don't have any details around what that means.
Right.
And
it's just fear.
It's fear. And then, of course, to be fair, I hear some really beautiful ones too, like really with detail. Or, I don't really know, but my mom said it was one of the happiest days of her life,
right.
That...
My mom used to call me, she still does, I'm 34.
Yeah.
She's called me every year,
yep.
or I guess she told me my birth story every single year growing up. To be fair, it has changed over the years. She is actually a real storyteller. So she has, created some differences there, but...
that but yeah, I've done the same thing as told my kids their stories. And so it is important to tell the story, but it's how the story is told. So that's part of it. This is an aside. But if you are listening, you as a parent, if you are a doula or a parent listening, or who, birth worker of any kind, your children should hear your stories. But it's how you tell your story. It's not to lie to them. It's not to fudge the truth in it being a lie and painting it not to what it was. But if it was really hard for you, if it was you suffered some trauma during that, or it was an unexpected experience for you, your child doesn't have to hear it in the way that I end up with these children and adults hearing their stories.
You're planting the seeds for their construct around birth.
Right. And it's really important. And so when you hear these stories, Melanie, in prenatal, what do you do with the ones that are like, well, my mom said, she just couldn't get me out. She wasn't, her pelvis was too small. Her concern is that the genetics will be the same for me.
Mm-hmm. Well, first of all, I would say, are you planning on having your mother in the room?
Yeah. Good. Excellent question.
Please no.
Yeah.
I have another exercise that I do within here, which is inviting 3 things into your birth. So we talk about what the construct is. What have you heard? What's your idea of birth? What do you think? What's your vision for this birth? If you were to write out an ideal birth plan, and not a plan at all, but just what's your ideal birth? What would it look like?
The vision.
Yeah. And it's not like the list that the doctor or midwife gives you. It's just write it out. What kind of day is it outside, and what are you and your partner going to do? How are you going to make this day special? And just really focus on the positives. And I do find that some people don't want to do that homework. The tell your ideal vision, because then it's kind of expecting it to go that way. And I'll talk about why can't we expect the best? Why can't we plan and prepare for this to be an enjoyable experience rather than fear the worst?
Right.
And then inviting things in. Well, if you are especially fearful about something, let's invite something in that will counteract that you will really make a goal around in your birth, so that I know when you go to that place what I can do to pull you back. Right.
And I think, though, with some people, and I know you know this as well, and you do this, it's deeper than that. It's the person who has a family history. I've known quite a few of these women, birthed with them and also taught them and just met them in my life, who has the family history are mother and sisters who have had cesareans. And so it's the mark of the C on them. And it's like, why bother? I want to bother. Well, and that lack of support around them.
And then what they're hearing from the other side throughout their pregnancy.
Right. And how you really have to take kind of like the gentle digging out with them of that stuff and flicking it off into the garbage. Like, okay, no, that doesn't really fit in there with you, does it? But you can't make somebody flick it off. They have to do it themselves. And it's that guidance of talking and letting, I think it comes down to, again, we are different individuals, and you're making different choices, and you are carrying a different baby. And yes, plan this for the optimal way, always knowing that, yes, it could happen it could end up with that cesarean that everybody thinks you're going to have. But maybe it won't. And because you're making such positive choices, you're giving yourself an opportunity to walk at least this pathway differently than they walked. And it's not that they're bad or wrong. And I think that's what happens is, we know that often when somebody has had like this what somebody might call that most, like our last podcast that we did last time, episode 62, where the mom had 3 cesareans and then ended up having a vaginal delivery. Her elation about that, I'm sure she just wants to tell everybody that story, especially women who are in circumstances like herself. And unfortunately, what can happen is those women feel like they can't really share their good stories because they don't want to hurt somebody else's feelings, because they get backlash. They get the defense mechanism comes out in the other person and they give pushback.
I couldn't do it.
Yeah,
this
I couldn't.
What happened to me.
Exactly. And they start explaining it in a defensive way, whether they're intentionally doing that or not. That's what it is. They're not allowing this woman to share what she has not. She's not comparing herself to somebody. Mm-hmm. She's just telling her story. And I think when it's a family history, it's the exact same thing for so many people. It's that, what are you saying? I did it wrong? What are you saying? I didn't try hard enough? And it's that familial also. So it's hard. Worse situation, because it's that you love each other, I hope. And how do you say, no, I'm not.
Right.
But that's how you say it, is no, I'm not.
And that's where the boundaries come up.
Exactly.
And setting your intentions with the people that aren't giving you the positive advice that, aren't giving your client the positive advice that they're seeking. And boundaries is something that comes up a lot in prenatals. Boundaries around just people, just spending time with them prenatally, and then boundaries around who's going to be in the room,
right?
And boundaries around postpartum and what's happening there. So I think all of that kind of ties in together, how to also talk to those people in a well-intentioned manner, but setting boundaries.
Right. And then it's with the partner, it's the same thing, because they will walk in the door. They have preconceived notions as well as to what birth might look like. Like, I think about my kids, if they were to choose to have children, that they have a really, they have a limited view. I'll say it that way. To me, it's a wonderful view, but it's a limited view of what birth is like. Mm-hmm. They saw home births and they saw babies just come. Mm-hmm. And that's wonderful. But I wouldn't want them to think that they have to have their babies either in that way, or that what if their body just couldn't do that in the same way that my body. So it's also these good stories that can be so, it's this, we want to affirm, but there's a reality that birth may not turn out the way we envision it either. I mean, it's, I remember this woman who, she was born at home, her siblings were born at home, so that was just normal to her. So her plan was to have her baby at home as well. And her mom had them in England, and she was living in the States at the time. And it didn't turn out that way. And it wasn't, actually, it was irrelevant that she was in the States. It just didn't happen for her. Mm-hmm. And she said she felt like such a disappointment to her mom because she couldn't do what she had done. And she felt like such a failure on top of her failure. She felt like a failure because she had always had this ideal that she would be just like her mom. Mm-hmm. So whether it's the good story or the one that has, more triggers around it, it comes back to what you are, your own person. What can you do to make this birth what you would envision it to be? Mm-hmm. And like you said, invite in those things that will support that, and keep out the ones that won't support it. I love your first reaction if the mom said all of those things, like, yeah, we already did a podcast on who you want to invite. Yes. But it's like, that is not probably the optimal person to have at your birth. As much as you may love her and she loves you, it's like, do you really want that energy in the room of somebody who does not really think that you can succeed? And somebody was just sharing that they had planned a home birth, and in the end, they ended up being transported in the hospital, non-emergency, but just for aid, relief, and some more assistance. And in the end, they ended up with a cesarean, which they felt was medically necessary. Mm-hmm. Not an emergency, but just it wasn't happening. And her family had never been supportive of the home birth thing. And her dad posted immediately on Facebook his daughter's name, baby gratefully was born by cesarean. And she said, the way I received that was that, it was like he was justified in his worries that whole time. And she said, and I was devastated by the experience. And then seeing that just added to my hurt of what I had already gone through. So I think, we want to talk about...
Which also brings us to the whole thing of reminding anyone that you're going to share, that your client is going to share the news with, that they are not to post
on Facebook.
Anything on social media.
I know. And
that is something I cover in prenatals too.
That's good. Yes. So there's the familial history.
And then there's also cultural. And somehow I got hooked into the firefighter scene in Richmond.
It's interesting because we have doulas who are married to firefighters, and I both male and female. Yeah. So yeah. Mm-hmm. So
I've been to probably 15 or so firefighter family births, and when the partner is a firefighter, I have found that they are really tense around birth because the births that they have seen have been emergent.
Right.
And they are trained in birth, but they are not trained in birth.
It's like, oh God, can we work on a heart attack instead?
Quick, let's just get to the hospital as soon as possible. And so I've had to do a lot of work with just calming them down and really normalizing what a different sort of birth looks like.
Right. Well, it's the same thing if you're working with somebody who's either they themselves or the partner is in the medical world.
Absolutely.
With residents, nurses, whether they doctors, right, whether they be in OB or not, that so professions can be part of what is the construct as well. Yeah. And then we hear this all the time. The cultural perspective of childbirth is so askewed that it's very hard for most people who come into, I'm pregnant. They think, okay, I'm going to do this. I'll read what to expect when I'm expecting. I choose the OB that my friends got or the one that the insurance company says I need to go to. Doesn't really matter. Aren't they all the same? And then they hear about how incredibly painful childbirth is and that they should either schedule an induction and so that they can get their epidural as soon as they want it, or they just want to get the epidural sooner than later. You don't want to wait. And they hear that from friends, they hear that from family, they hear it from TV, and then they sadly hear it so often from the medical people as well. And again, not to pick on anybody, it's not any of them because they are like, let's destroy this experience. It's their reality. It's what they know, and so they think they're giving protection to people. But that's really important. What is your experience with childbirth? That is the question. What is your experience with childbirth? What are the conversations you've had with friends and family members? What is it that you have read that makes you, is impacting this, let's really talk about it. Let's really have a dialogue. And both of them, because I remember being with it was the partner who really, I was his doula. I mean, even his wife was just hands down, I was his doula. I mean, he actually had to have one-on-one prenatal visit with me, which was totally cool. One time I saw him at the gas station, and they were going to have their first baby, and it was in the hospital, and I was their doula, and he said, I said, so how are you doing with everything coming up? And, it was just coincidental. I saw him and he said, I feel really, really nervous. I keep watching those baby stories and it just makes me so nervous. And I gave him a punch in the arm and I said, quit watching the baby story.
Yes.
Like, no more. I said, that's a prescription order here. Doula's order, do not watch it. And he was like, what do you mean? I thought that was a good thing for us to watch. And I said, no, because if you're being terrified, it's telling you it's not a good thing. Yeah. There's a reality here, but it's not in that picture. You can't watch that as your information. Talk to people, read things, but come back to yourself with each other. And this is why I'm around, to help you sort out those things, not inundate you with more fear.
I really like Hensi Goer's book, The Thinking Woman's Guide to a Better Birth, for my medical clients. Mm-hmm. I think she does a really good job of laying it out fact by fact and not so opinion.
It's so interesting because her foreword says this, and I love her honesty in her foreword. She said, I am biased, but it's based in evidence. And I think
I love that.
She states it clearly. It is a bias, but it's not based in her opinion, which it turns out that became her opinion, but it's based in evidence. And you're right. It's an excellent book. It's one of our required reading on our certification because it is it makes you think. It's critical thinking. So I think our point being to everyone, which I think is obvious, but I am a strong believer for myself and for all of us, is not to assume anything is obvious. It's like when you can't find your glasses and they're right on top of your head, It's obvious, but it really isn't. This is an important part of prenatal. It's an important part of getting to know your client. It's not all about, what an epidural does and what Pitocin and why they may not want the risks and benefits to the interventions, which are all part and important. But it's the emotional component of this and the
so huge.
Yeah, the belief system, the construct that they're coming in with, that can greatly, the psyche can impact birth, and we're not even talking about if they've had previous traumatic births themselves, which is another topic, or previous trauma in their life that was not related to birth, but some kind of physical, emotional abuse that they've suffered, and how that can play into the way they birth as well. We're just, in this episode, it's really just about that, more than anything to me, what your family told you. What were the stories?
And what your everyday life shows you.
Exactly. Yeah. But, I think you had some great insights, Melanie.
I think you did too, ToRAISE.
Oh, yeah. Okay. Well, thanks to everyone.
Thanks for listening. Stay with us for a tip. Be right back. So our tip today comes from my weekend last weekend.
Straight from Melanie's weekend.
Straight from my life. I usually teach on Sunday afternoons, and I just finished a series, and I found myself with this whole big, wide open Sunday. And I, much to my husband's chagrin, and you already know my husband, everybody, I decided to completely rearrange our office/guest room downstairs, and just moved all the furniture around. One of those days I just threw out a bunch of crap, and my husband's a hoarder, so he was very tense about me going through things. But I threw so much stuff away. And I carved out this little space as my office. And I work from my phone. I mean, I am so bad about everything. If I lost my phone, like my world would just combust. So I'm also a huge calendar person. I have to have something I can see. Like I have my phone calendar and I have my other calendar. But I have my own little space right now that has a big whiteboard with all of my clients on deck, a calendar when I have prenatals, postpartums, my lactation appointments, everything just right there in my own space. And then I can close a door and go sit at this really calm, peaceful place in my house.
Which is, if you've ever been to Melanie's house, you would just kind of laugh that she actually found some space with her 4 wild children and husband.
Yes. Yeah.
Not to mention her.
Right. Yeah. And so, but I did. And of course my kids are like crawling on, like, this is my space, get out of here. But, it felt really good, and it felt very, very
productive.
Real and productive. And so I encourage, I challenge you guys to, even if it's just a little piece of your bedroom or just have a physical space. I tell my clients to create a birth altar,
right,
to labor in front of, to gather strength from. Well, I've made my business altar now in my house.
And I think you're fortunate because you have that guest room / office. And if you have that and it's full of junk, here's the motivation to give yourself that little space. But if you don't have that extra room, is there a space in your kitchen? Is there a space in your, another room? The bedroom, absolutely, except for the feng shui, which I'm not one, but says you should not have your work and your sleep in the same place. Well, some of us don't have that option. Right. So you create it in a way. I like the idea of it being an altar. It's where you can just go. Ideally, you want a door, like Melanie's saying, but if it's not there, something that, even a screen, go to the thrift store and find a screen or something to put around, and it's your place to, you're professionals. And you want to have that place, a filing cabinet, well, that's right, that's old. A filing cabinet where you keep the paper files that you still write out.
I have a filing cabinet.
Good.
Yes,
Good.
Yes. I have all my extra handouts. I printed off a bunch of, my intake forms and contracts to have. Because also that's another scramble when you get out the door to go to your interview or your appointment.
Right. Everything in one spot that's your business. Yeah. And for some people, it's mobile. It's in a box, and I've seen this with women in years past where they didn't have a space or they didn't have that quiet space. And so they kept things in like a big legal box or some kind of with handles. Yep. And they would then go to a coffee shop or go to the library, and they would bring that with them, and that would be their workspace too, where they just had everything organized for themselves, or just knew where everything is that you need. But you're running a business, and it sounds like I'm sure many of you already have done this, but I think a lot of people don't, and they do it on their phone, and they do it by, okay, when I get someone or what. But be organized, be ready, and then there's it's like taking clutter out of your brain.
It's so nice.
Yeah, I think it's a great idea. So thanks for sharing that.
So go home and create your business altar.
That's right. Okay, everyone have a great week. Thanks for listening.